When we engage with young patients or children under 16, 18, depending on the country, we need this legal consent from their parents or legal tutors. So that's one of the main issues, and what it makes more challenging and more difficult to engage with young patients is these legal somehow requirements in order to do the engagement. But then if we go into like more granular, it's also the ability to speak or to communicate their needs. So imagine if we have a group of young patients from 6 to 8, it might be difficult perhaps to have a focus group and to have different questions rather than if we have a group of adolescents or teenagers that are 16, 18 that are more willingness to share their experience in a discussion. And then you need to think which methodologies, which tools do you need to use to engage with the different age populations. And it also, of course, depends on the rare disease condition and the ability to speak that this might be affected as well, depending on the condition. So there are different type of elements that makes young patient engagement more challenging, more time consuming sometimes, and of course there's more resources needed. And that's why we have seen in the environment of rare disease that there was a willingness to do that, so that the developers, clinicians, researchers, they wanted to involve young patients, but they were a bit lost on how to do it. There are lots of different initiatives in Europe ongoing, but there was not something more practical on how to do it. So with the group, we have decided to develop a checklist on what is needed or what are the elements to consider when doing these activities, and then a decision tree on how we start this work. So in which context the activity is going to be part, which methodologies are already out there that you could use, and then what is needed to do the patient engagement activity with young people.